Good morning, good afternoon, and good evening. Welcome to the 523rd day of continuous Zoom session by IFPH. Today, our guest is Dr. LUBNA KAMAL, MD Homeopathy, MBA, PhD, and the topic is scope of homeopathy in treating chronic kidney diseases. She is the homeopathic nephrologist treating renal failure and other patients suffering from other chronic illness like since the last 2 decades. So we are expecting a nice presentation from you on behalf of IFPH. I'm welcoming you, Doctor. You can have the platform for the next 45 minutes.
Thank you so much. And a very warm evening to all of you over here, and a happy Basant Panchami too. So this is Dr. LUBNA KAMAL, and I am an assistant professor in State Jawaharlal Nehru Homeopathic Medical College. I have also been practicing homeopathy since last 2 decades almost, and I've worked exclusively on renal failure because one of my cousin had nephrotic syndrome, and I have as a child I have seen him suffering. So when I grew up, I thought I'd do something for kidney patients, and that's how I started looking after them. And renal failure, the percentage of renal failure patients is rising every single day. And there was a news item published in Hindustan Times some few years back that in India just now 1 in 10 people are suffering from renal failure. They have some kind of renal failure in India. So what is renal failure? So let me first discuss that. So what is the work of the kidneys? The kidneys, they maintain equilibrium of the fluids and electrolytes inside the body. And its other important function is to excrete the waste. When there is imbalance of both in the equilibrium of electrolytes and fluids, and when there is excessive creatinine or urea or uric acid or other things which need to be out of the body, then is when it is known as renal failure. But this has to be persistently, this should persist for 3 months at least. Not just once. I mean, if the reports are like that for just once, then it is not renal failure. There should be persistent rise, or the blood sugar, this blood urea or the creatinine should be there in consequent reports. So then it is known as renal failure. And there are, this is subcategorized into CKD, which is chronic kidney disease. Then there is CRF, which is chronic renal failure, which is more popular term. And there is ESRD, which is the end stage renal disease. So CKD is something we are not aware about. CKD is when it's the beginning of the kidney damage, renal damage, when the disease starts, when there are absolutely no symptoms, and when there are the reports, the blood, all the other reports are might be normal, then too the patient can be suffering from CKD or chronic kidney disease. Here, the GFR at this point of time when the patient is in CKD, the GFR is less than 90. So that stage is known as CKD. When this GFR falls below 60, then is when it is known as chronic renal failure. And if the GFR falls below 15, then it is known as end stage renal disease. And end stage renal disease means that there is some, the kidney cannot perform its function at all, and the patient is dependent on either dialysis or they have to go for transplant. So this is the basic outline. And proteinuria, one more thing, that proteinuria should be more than 30 mg. The amount of protein in the urine is, if it is persistently, if it is beyond 30 mg, then it is renal failure. And if the creatinine is like 1.5 or 1.3, there are various scales. So if it is persistently beyond 1.3 or 1.5, then it is known as renal failure. Now coming to the cause, which is the most important, because that is something we have to save ourselves from. So the most important cause in India right now is the use or abuse of painkillers and drugs. People in cities, both in the cities and the villages, they just want to be well overnight. They just want to get rid of the pain in few minutes or few hours. They do not hesitate to take extreme painkillers and other drugs as well. They just want to be cured of anything they are having. So use and abuse of various drugs is leading to the most cases of renal failure in India. Then the second thing is that I am having a lot of people from the younger generation who are having, like, boys 25 years old, 20 years old, 30 years old. They are coming, even girls, not just boys, even girls. They are coming with renal failure. Why? Because they are going to gyms. They are being giving supplements to reduce weight, or for bodybuilding, they are taking all kinds of steroids and protein-rich diet. So there are lot of patients, younger patients, who are coming with renal failure because of this exercise and gym and whatever supplements they are taking with it. Then the next cause is high blood pressure. If the blood pressure is uncontrolled for a long time, then it leads to renal damage. If the blood pressure, like if it is even little higher than normal, 120, 130, if it is higher than that, then it is damaging the nephrons every single minute. The blood pressure should be, it depends on the age. This is just an average value, but the blood pressure should be within the range which is good for your age. If it is higher than that, then every single day the nephrons are being damaged. Then there is uncontrolled diabetes. High blood sugar is extremely damaging to the kidneys, and it is most difficult to treat. Diabetic nephropathy is very difficult to treat. And that the first symptom in diabetic nephropathy is proteinuria. That is the first thing which comes up, but people ignore it. There is just traces of protein in the urine. So people ignore it till it's very high. It's plus. So, and the next thing is, if there is any kind of obstruction into that urinary tract because of stone, because of stricture, which causes hydronephrosis, the urine starts getting collected in the kidneys, and the cortex gets damaged, and that is how the kidney gets damaged. And uric acid is very important, because the people who are non-vegetarians, if they are having meat indiscriminately, they are having it every day, they are not having proper fluids with it, so as to excrete the uric acid, they get stones. And mind you, the uric acid stones are usually the staghorn calculi, which are very huge. They occupy almost the whole of the renal pelvis, and usually the patients come to know when the kidney has already been damaged. So all those people who are exclusively on a non-vegetarian diet, they should be very, very careful regarding their uric acid levels, because if there is stone in your ureter, if there is a staghorn calculi, then there is almost it's very difficult to treat, to take out that stone, and to avoid that hydronephrosis and all. So this was about the causes. Now I'll speak about the symptoms. It's very difficult. I usually say that renal failure is more lethal. It's more difficult because than this liver cirrhosis, cancers, or heart diseases, because till the kidneys are more than 70% damaged, there is not even a single symptom. Usually there may not be even a single symptom till you have lost more than 70% of your kidneys. And the first symptom might be just loss of appetite. What we usually do, if a patient comes with loss of appetite, first they take the appetizers themselves. Even we do not go into such deep. We usually give china, we usually give other things. So that can be an indication for renal failure. Then the symptoms are usually they are very mild, like mild swelling on feet, mild swelling on the face, slight nausea, slight vomiting. There might be anemia. So all those symptoms are like very mild initially. Only there are very few people who actually come to know of renal failure early. I had a patient from Lakhimpur Kheri, and he was a 26-year-old chap. He came using a public transport to the clinic, and when I checked his blood pressure, and he was perfectly all right, and he had just returned from his honeymoon, I think, and he came for a very trivial issue, and I just checked his blood pressure. His blood pressure was 260 by 130. So I immediately asked him to get a blood test, and his creatinine was found out to be 23. 1.5 is normal, and his was 23, way beyond my imagination. And I just called the lab, and they told, no, we have checked it twice or thrice, even before you asked us. So he was absolutely normal, nothing at all. He might have had, I think he came with some visual trouble or some headache or very trivial thing. Had I not checked his blood pressure, the diagnosis would have gone. So there are very mild symptoms. One important thing is that if there are pains, night pains, pain in calves, pain in joints, which is due to low sodium, because of disturbance of this electrolyte, imbalance of electrolytes, phosphorus is high in renal failure patients, then the calcium in the blood becomes, the level goes down. So it might lead to some pains, and sometimes the patient comes with pain. So when we get them checked, we initially give like Rustox and Macphos and all calcium and vitamin D supplements. So, but when you get them checked for vitamin D and calcium, if the calcium levels are low, then you just give a glance to creatinine too, because at times that is the main symptom. That is the only symptom. That is the only lead. Then fluctuating blood pressure is almost always because of kidney or heart troubles, and mostly because of kidney troubles, I would say. If the blood pressure is too high, and then it is all of a sudden it is very low. So if a patient is there who comes and says that my blood pressure is fluctuating, always go for an ultrasound if the creatinine is normal, because the kidneys might have been shrunken, and the creatinine will rise later when maybe more than 80% of the kidneys have been damaged. So these are the most important symptoms, and there might be loss of, there might be anuria or dysuria or reduction in this urine output, but that comes at a later stage. Initially, there might not be any symptoms at all. The tests useful, how we diagnose a patient of kidney. It's a very simple blood test. The creatinine and the urine albumin, they together cost around, I think, 150 rupees. And if you get this checked, like people who are under 40, they can get it checked once a year. And who are above 40, they can get it checked twice a year. Those people who are having this blood pressure and diabetes, they can get it checked more often as and when it's required. So in the blood, there is this KFT, the whole panel of renal function tests, where the hemoglobin, the urea, creatinine, the electrolytes, sodium, potassium, calcium, phosphorus, uric acid, everything gets checked. Then the ultrasound is equally important, which gives the size of the kidneys, its ecotexture, because if the kidneys are damaged, the ecotexture gets raised. And then there is one term, corticomedullary differentiation, which is CMD, that gets destroyed, that gets blurred when the kidney is damaged. So sometimes I have seen patient went for ultrasound because of some other thing, suspecting a stone or just a routine one, and they found that the kidneys are already shrunken by 2 centimeters. These are real cases I'm talking about. So one should, if there is any kind of suspect, if you suspect that this patient can be of renal failure, or if I suspect myself that I'm having this kind of swelling, I should get ultrasound of whole abdomen done as soon as possible. And this ADPKD, I missed this. ADPKD is a genetic disorder, autosomal dominant polycystic kidney diseases. And what happens is that in kidneys, in both the kidneys, there are multiple cysts. Those cysts might be in other organs as well, in lungs and in liver too. But in kidneys, if there are multiple cysts, they lead to hemorrhage, they lead to recurrent urine infection, then because it leads to stone and renal failure as well. So at times patients come asymptomatic, they don't have anything, or they just have feeling of bloatedness, and despite carbo veg in China and lipo, it isn't going. So I have got this done, and they were the patient found out. Then is when the patient found out at the age of 50 that he is suffering from ADPKD. So this is something which needs to be counseled. If someone has ADPKD, his whole family, the blood relatives, each one of them should be scanned. They should undergo ultrasound, and then they should be counseled so as to avoid taking extra salt, to keep an eye on the blood pressure. If there's any family history of diabetes, then they should take care of that, because it will aggravate the renal problem. Then there is one more investigation, DMSA scan, which gives the exact GFR. What we get in a blood report, eGFR, it is estimated GFR, estimated glomerular filtration rate. But this DMSA scan, there's an isotope which is used to measure that, to calculate that. So that gives the exact idea how much of the kidneys are working. Now, if I talk about prevention, kidney disease is, I said that it is most difficult to diagnose, more difficult than cancer and CAD and cirrhosis and all, but it is most easy to prevent. It is most easier. So if you get, I'm running an NGO in Lucknow just now, and whoever comes to my clinic, we hold camps as well, whoever comes to my clinic, we check their blood pressure and diabetes free of cost. If they have blood pressure, I have scanned, I have taken these patients, I've checked randomly, and people were found to have sugar as high as 400, blood pressure as high as 180 by 120, and they were absolutely unaware of that. At that point of time, they came to know that they are having high blood pressure. And then when I went, through my NGO only, I sent the samples for creatinine. It was found to be raised. Thankfully, it was just 2 or maybe 1.8. But this is something very, very important, and I'm going to write an application to the PM and the CM that this should be mandatory to be checked for all the patients in all the government hospitals, that blood pressure and diabetes are 2 major killers. So these can be avoided at least once in 3 months. If you just get your blood pressure checked, renal failure can be avoided to a great extent. If there is any possibility, if there is any family history of diabetes, do get your sugar checked regularly, twice or thrice a year at least. So by using these two things, it can be prevented to a great extent. I would say more than 50% of the patients can be saved. Then the next thing is never ever self-medicate yourself, never ever use OTC, over-the-counter drugs, because they do more harm in the long run than you can imagine. If the blood pressure or the blood sugar is high, then go for creatinine and urinary albumin. It's very cheap, it's very easy. So we can avoid this renal failure, that we can prevent renal failure to a great extent. There are, now coming to the treatment, I would like to say, first I'll speak about the allopathic, the modern medicine, whatever is available to us. So there is not even a single medicine throughout the world which can reduce creatinine or urea even by one single point. There are absolutely no medicines. Whatever is there, it's either Ayurvedic or just hit and trial. Nothing else at all. So what are we left with in modern medicine? It's just transplant and dialysis. Dialysis, which is hemodialysis, and there's the peritoneal dialysis. Peritoneal dialysis is done through the stomach. They put a tube, but it's very dangerous, because almost all my patients who ever went for this peritoneal dialysis, they ended up having peritonitis, then septicemia, and then death. So I never advise my patients to go for peritoneal dialysis. And if you are treating, if you are giving homeopathic medicines, it is easier to treat and reduce the frequency of dialysis in hemodialysis. It's very difficult for peritoneal dialysis. So as a homeopathic consultant, I would suggest all the homeopathic doctors to tell their patients, to counsel them to avoid peritoneal dialysis. Only in the condition when hemodialysis is not possible, then only they should go for peritoneal dialysis. Now speaking about the transplant, the late politician Amar Singh sir, he had 2 transplants. He underwent transplant twice, and both of them got rejected. I have seen transplant rejecting within 24 hours. So it should be kept as a last choice, not the first, because you never know how it will fare, how well it fares. And besides, patients are not aware that in order to get that transplant working, they have to take medicines worth thousands even after transplant. Transplant is not just one-time thing. It is a lifelong process. For transplant, you can spend 5 lakhs. There was a patient of mine from Sultanpur, from a village, and he sold his land because the doctors had, at SGPGI, they had told him that you just bring 5 lakhs and we'll change your kidney. Okay, someone donated and it got changed. But after that, they told him that, okay, now you have to pay for 20,000 per month, 20,000 bucks. Why? To keep this transplant working, because they have to be given immunosuppressive medicines. So patients are not aware. At times, patients are not aware of this, and they just plan for transplant. Now that this transplant has been done and I have a new life, they start eating out, they skip medicines, and that is how it gets rejected. So this patient from Sultanpur, he came to me and he said that, okay, now I'm going to commit suicide, because if you don't treat me, I don't have any medicine, any money to left for my treatment. And the next thing, after, if you fail as a doctor, the next thing I'm going to do is commit suicide. So now, speaking of homeopathy, homeopathy has immense scope for patients and for homeopathic doctors as well. There are homeopathic doctors who are not, I'll speak about the doctors just now, that most of the homeopathic doctors, why I joined this government job, because what I was looking at, is the patient, the doctors who were treating, the homeopathic consultants who were treating the patients, they were not equipped well. They lacked knowledge, they lacked the data, the statistics, they lacked the, what should I say, the research. They didn't have that research potential. They did not know how to maintain data, how to take a chronic case, how to go about it. So that was the reason why I joined this. And thankfully, the first batch I have taught, the students are doing really well, because I tried inculcating them that you can be a specialist as well. If you work very hard, then you can do very well as an allopathic doctor. So don't be in a complex, and they are doing really well. So to all homeopathic doctors over here, I would say that focus your energies. I mean, whatever you are doing, you do that, you continue with that, but focus on your all your energies where the modern medicine has restrictions. They are not able to do, I mean, you cannot go and take the place of a surgeon. But in medicine, there is lot of scope where homeopathic doctors can do a lot of things. And for that, you have to study very hard over the subject. You have to consult those patients, and you have to take out data. What medicines are working? What has been found to be most useful? Why is patients from this area having this trouble? And there are a lot more things. And regarding patients, homeopathy has immense scope. I'll explain this with a small example. Like when a kidney is being transplanted, what happens is you take a healthy kidney from a healthy body. Now the donor is left with just one kidney. How is he going to survive with just one kidney? Why? Because the kidney that is left, there is compensatory hypertrophy. The stem cells in that kidney, they multiply, they regenerate, so as to increase the size of the kidney so that it can bear the function of both the kidneys that was initially being done. So this is very much possible with homeopathy. Constitutional homeopathic treatment can definitely increase the adult stem cells in the body. These adult stem cells, everyone knows, I think, about stem cells. There's a lot of talk on that. So there are stem cells in the body. There are stem cells at birth. Then there are adult stem cells which we carry throughout our life. So if you are leading a healthy lifestyle, you will have more and more of adult stem cells, and these can be used when your kidney is damaged or your liver is damaged or any part is damaged. So the nephrons, they get repaired. I have seen cases. There's a patient of mine from Basti. She was 65 years old. Her kidneys were 7.5 something, and after a year, 80 months of homeopathic treatment, her kidney was 8.2 centimeter. There was a patient of mine from Assam. She was a young girl. She had this some birth defect, which is why her kidneys failed, and her kidneys were again 7 centimeters, and they grew by 1 centimeter. So what is that? If the homeopathic medicine is constitutional, it will definitely improve the adult stem cells in the kidneys. And I've treated so many cases with just sulfur, just phosphorus, by just giving Heparsult, by just giving lycopodium. And I give other medicines as well if it is required. I give epocinum, I give apis, I give eel serum. But if the constitutional medicine is not well selected, then you can just make the patient stable. You cannot improve. You cannot improve the size of the kidneys. You cannot bring down the creatinine. So a body has immense power of regeneration, and homeopathic medicines, along with healthy lifestyle, along with yoga, light exercise, little bit of walk, it can improve a patient incredibly. And the most important thing is quality of life. If that improves, if the patient starts feeling healthy, if the patient starts feeling well, half of your job is done. And I give medicines, I've given medicines to all stages of renal failure. It has worked at CKD, which is the most initial, when the creatinine is just 1.5, 1.8. I have treated patients of renal failure, CRF, and I've brought them, from CRF, they have reverted to CKD. From end-stage renal disease, people often say that I've started with dialysis, so now nothing will work for me. No, it's not like that. I have reduced, and everyone can, all homeopathic doctors can do that, reduce the frequency of dialysis and improve the quality of life. And then there are patients who have completely stopped dialysis. So from end-stage renal disease, they have reverted to CRF. So that's all for today for now. Over to you, sir. And if there are any questions, I'll be pleased to answer. So I forgot about the management part, that the diet and the rest of the management is very, very important. What happens is, why homeopathic doctors fail at times is because they might select the right medicine, the constitutional medicine. But what happens is that they stop all the allopathic medicines that the patient is dependent on. The diabetes medication, the blood pressure, which is being taken care by allopathic medicines, you cannot stop it all of a sudden. For phosphorus, they give phosphorus binders. For uric acid, if it is very, very high, there are allopathic medicines to take care of that. So you cannot just stop it all of it at once. You must know what is harming the kidneys. You can stop the diabetes medication if it is harming. The oral hypoglycemic drugs, which are very harmful at times, which are the cause of the renal failure. So you stop that, but don't just stop all the other medicines. The second thing is that patients come and they tell that we are having beetroot, we are having pomegranate juice and all. So if you do not know what to advise them to diet, what to restrict, how much of fluid to be given, then obviously the patient is never going to improve. So, and this again would require lots of studies. So we do not study. That is why we aren't specialists and we aren't charging the patients. We are not charging like consultation much, because why we lack knowledge. So management is as important as selecting a constitutional medicine. And management is something which you learn in a hospital while you are treating the patient, while the patient is admitted somewhere, and if during the house job and during the course of the study, that is where you learn the management when you are actually in the hospital, and rest of it from the book. The second thing is that there has to be a differentiation in acute and chronic renal failure. If it is acute, then you cannot cause it that I have told a case of chronic renal failure. For chronic renal failure, I have told that there has to be 3 months. There should be this persistent rise of creatinine, and there should be some other kind of changes, maybe biopsy, maybe through ultrasound. It should be a case of chronic renal failure. If you claim a case of acute renal failure, because acute renal failure sometimes it gets cured by itself. I mean, the creatinine rises momentarily till 7 or 8, and then it comes back to normal. So that might have been acute renal failure. So this is something which needs to be differentiated. Thank you so much.